So welcome back to our next session. So good morning, Professor Viswanadham. So can you unmute? Your video is, yeah, you're visible, sir.
Can you hear me?
Yes, perfectly, sir. It's fine.
Okay.
Yeah. So welcome back to our second keynote session. We have Professor Viswanadham, who is an INSA honorary scientist in the computer science and automation at the Indian Institute of Science from 1967 to 1998. He was faculty at the Indian Institute of Science. Professor Viswanadham was professor and executive director for the Center of Excellence Global Logistic and Manufacturing Strategies in the Indian School of Business during 2006 to 2011. He was deputy executive director of the Logistic Institute Asia Pacific and professor in Department of Mechanical and Production Engineering at the National University of Singapore during 1998 to 2005. He is the recipient of 1996 IISc Alumni Award for Excellence in Research. He was conferred the Distinguished Alumni Award in 2009 by IISc. He was awarded the 2012 Professor S.K. Mitra Memorial Award by the INAE. He is the fellow of IEEE, fellow of Indian National Science Academy, Indian Academy of Sciences, Indian National Academy of Engineering, and the World Academy of Sciences. Professor Viswanadham has made significant contributions to the areas of manufacturing logistics and global supply chains networks. He is the author of 4 textbooks, 9 edited volumes, over 240 journals, and top-tier conference papers. His current research efforts are on use of new technologies for the future supply chain network design using blockchains and smart contracts, and design of competitive business models and application to healthcare, agriculture, pharma, and green supply chains. So we welcome you, Professor, for the NetHealth 2022. So the title of the talk would be Design of Healthcare 4.0 Platform Models Healthcare. Over to you, sir.
Thank you. Okay, how can I share now the screen?
Yeah, sure. You can, sir.
Yeah, where?
You have to click on the arrow next to your mic.
Yeah, okay. Yeah, share screen.
Yes.
Entire screen. Yeah. Share. I don't know why it is not.
You have
share.
a arrow. If you just click on that present to audience, if you can make out.
Entire screen window, Chrome, tab.
Entire screen. You can click on entire screen.
Yeah, I did.
And click on share.
Yes. Yeah, we are able to see the screen. Now you have to open the PPT, so you can click on PPT. Yeah. You can make it slideshow. Full screen. Yeah, perfect. We are able to see it.
Okay, so can you hear me also?
Yes, sir. It's perfect.
Can you see me?
Yes, we can see you. It's clear.
Okay, so basically, thank you very much for inviting me for this conference talk at our workshop. As I was introduced recently, I'm working on healthcare, and I call it Healthcare 4.0. I'll tell you what it is and so on, since we have only 30 minutes. So I had to run through these slides and also quickly go through this one. First, I'll introduce what is Healthcare 4.0. and the current health infrastructure in India. My focus is on health infrastructure and what are the new innovations that are changing the healthcare industry. All of us know that earlier you had to go to the doctor or doctor has to come to your house. Now you can talk or video call and so on and all that. And then there are what are called platform business models, which connects lots of hospitals, doctors, and other facilities to the consumers. So, and India needs a health service revolution. I'll just mention that. And what is healthcare? So this means the now we have started industry revolution and industry revolution three, and now we have what is called cyber physical systems, which uses robots, internet, and physical delivery, and a lot of online delivery and other things. So a lot of these things have changed in the industry. So what is healthcare 4.0? Healthcare 4.0 is earlier used to, there were lack of resources till 90s. So doctors used to come home or you have to go to their doctor's house, and afterwards you have digital tracking was introduced, and there were hospitals with MRIs, ECGs, and so on and all that.
Excuse me, sir. Sorry to disturb you. Actually,
Yeah.
your screen is not seen. Your share PPT is not seen. I think by mistake
really?
it got stop presenting. Yeah. Then you have to share it again.
What about now?
No, not it. We are not able to see.
But earlier you said you were able to see it, right?
Yeah, we were able to see in the beginning, but now all of a sudden it got disconnected.
Oh God, let me go back again. Yeah, can you speak or you can see me now?
So no,
You can
yeah,
see
we
me?
can see. Yeah, we can see you. If you could click on that arrow button next to the microphone again.
Yeah, share screen. Yes.
Yes, share
Entire
the entire screen again. Yes, you can please restart click on your PPT and continue from.
Now you can see.
Yes, sir. Can you put it on the slide mode? Slideshow mode.
Now you can see.
Yes, sir, it's fine.
Huh?
Yes, sir, it's fine.
Okay. So you have basically healthcare 3.0, which is you have electronic records, wearable and implementable systems, and so on, and are used. Now we are going into using technologies like cloud computing, fog, edge computing, big data analytics, artificial intelligence, and real-time access, and so on. So from 2016, things have changed, and there are a lot of startups which are coming into this particular domain. So now there is one fundamental difference that is happening now. Current focus is on the history and building capacity to high physical like hospitals and all that. But what is the future focus? The future focus is going to be promoting healthy lifestyles, vitality, and wellness in primary and secondary prevention and early diagnosis. It also includes spiritual, mental, and emotional components. So digital healthcare system is based on a platform which includes both incumbents, meaning the previous doctors, hospitals, and so on, and non-traditional healthcare players like spiritual, mental, yoga, and other kinds of players. So what is the future? The future is digital medical platforms, online medical consultations, smart hospitals. What is smart hospitals? I'll come to that later. Diagnosis and health treatment using big data analytics. Now the diagnosis is done by the doctors by testing the patient directly. Now this can be done through collecting the data and so on. There are startups now which basically, if you tell the symptoms and if you talk to the robot can tell you which doctor you should visit and so on and all that. There are a lot of things happening in this particular digital medical platforms.
So sorry to interrupt your.
I'll just go through very quickly because all of us know this. The
Sir?
patient goes to the hospital.
Sir, sorry to interrupt.
Sorry?
Sir, sorry to interrupt. Your slides are again not visible. Your by mistake some shared. Your screen is not visible. Can you share screen again?
Now it is not visible?
No.
I don't know what's happening.
Are you able to click on the arrow share screen again? By mistake, some key must have been pressed.
Sir, maybe you can use the right arrow to change the slides. Because if you click on that blue color, stop sharing, it will usually stop. So you can click on your right. No. Now it's fine, sir. So to change the slide, you can just click on the right arrow on your keyboard so that it's easy. It doesn't stop sharing instead of using a mouse.
Oh, I see.
Yeah.
Right arrow on, I see. Okay.
Yes. Now it's fine, sir. You can go ahead.
Okay. So basically, we go to the hospital and depending on what the hospital says, you can get a lab test, blood test, or blood pressure or sugar or something like that. And you go to a specialist and come back with here's this one. And later you go back to the doctor again and then I invite a specialist and you're the treated specimen. So basically what happens here is currently you have to go 3-4 times to the hospital and so on. So that's what is happening. Now, but what is the hospital ecosystem? All of us think only we are going to the hospital and things are happening. But now there is if you call what is called ecosystem, what are all the kinds of things that are involved in the hospital? You have a patient portal, basically, where either it is in the hospital website, you have doctors and nurses and other staff, you have insurance companies, ambulance transport, and you have clinical labs, you have pharma companies and specialty hospitals and many, many more. So a patient goes to the patient portal and he was sent to the doctor. Doctor says, go to the clinical test, and afterwards you go and buy the pharma and you pay through using your insurance or your cash, and it goes out. Sometimes if he has to go to a specialty hospital, he is taken in an ambulance and so on. So basically, this is what we call the ecosystem of the entire thing. Now, who controls the entire ecosystem? I think, unless this one, the doctor may suggest you get the blood test, you may go to somebody which is nearby and so on and all that. Now, what are the hospital costs? If you look at the hospital, land buildings constitute 40 to 50%. That may be surprising. All of us think doctors are paid, and the doctors not. The land, buildings, and maintenance and all that, it goes to 40 to 50%. Medical equipment cost is 40%, and 10 to 20% goes to human and operating expenses. Setting up a greenfield hospital, it will take 3 to 5 years because you have to basically set up this particular hospital. And there are technological changes that are happening. That is, if you have MRI, CT scans, and all that, they become obsolete, and every 3, 4 years, you have to basically change them. So, what are the new innovations that are changing this hospital? Can you see the slides now? Hello? Hello?
So we can hear you. I think due to some bandwidth constraint, the slides are still not visible, but we can hear you.
You can see the slides, right?
No, so they are again not visible.
Sorry?
So they are not visible.
Yeah, I'm not
We can hear
visible.
you.
The bandwidth is low, sir. The internet, your internet is little low. So that's the reason we are not able to, automatically it's getting disconnected.
No, my internet is fine. So shall I go back and connect to another internet?
No, sir, I think now it's fine, but only thing you can just reshare the slide, or you can email that so that we will show it from here. We'll present it from here.
Okay, so basically new technology. Can you hear me now?
Yeah, we can hear you. You are audible. It's clear.
Yeah, so new technologies, mobile internet, which connects to the patients.
But mobile
And-
internet will not really support the.
Sorry?
Your So we can hear you. You can go ahead, sir, because of your bandwidth, we are not able to see your screen.
Electronic medical records, electronic pill, which contains sensors and collect information as it travels through gastrointestinal tract, cloud health data storage, and 3D printing, which customized medical equipment. Bones are getting healed 40 to 80% faster with 3D printing. Then longitudinal patient records, that is cradle to grave or womb to tomb, the entire record from your birth to the death. And blockchain, which secures storage of patient and health information. And drones, which deliver medicine, blood, even organs. Robot-assisted surgeries are done in private hospitals. They are more precise and less painful. So, these are some of the examples that I have. And you have what is called Internet of Medical Things. It's a network of medical devices that feed vital real-time data to health IT systems. And connecting medical devices such as ultrasound, thermometers, glucose monitors, and ECGs for tracking patients' overall health, and there are smart beds in the hospital with no human help. And AI helps precise diagnosis using large sets of clinical data and images for cancer and chronic conditions such as diabetes, cholesterol, cardiac health treatment. I mean, these are all there available on the web or everywhere in terms of papers, research, and so on. So metaverse is replacing AR and VR, and NLP and AI, natural language processing and artificial intelligence, will help processing invoices, bills, and other documents. So if you take the hospital, there is what is called back office. The front office is the one which doctors see the patients. The back office is the one there are a lot of maintenance, invoices, bills, and other kinds of things, which is done using natural language processing and artificial intelligence, which is automated. So there is what is called big data analytics, which makes decisions, which is becoming very popular. It has descriptive, what has happened, that is, you note down what is the patient current situation. Diagnostic, why did it happen? That is the diagnostic, this one. You have to have predictive analytics, what is going to happen if you leave it. If you leave the blood pressure, if you leave the heart rate high, what is going to happen or something. Prescriptive, how can we optimize the entire situation and all that. Adaptive, how do we learn from these things. So medical data decision involves inferring from large volumes of data, which is obtained from Internet of Medical Things, medical imaging, genomics, and patient behavior. Everything. That is how you use this. And predictive analytics, which is basically using the data to find out what is wrong currently and what is going to happen and what medicine should be taken. These are all is currently being used in various applications. So what is digital healthcare? Digital healthcare market has telehealth, mobile health, EHR, EMR, remote diagnosis, and health analytics, and many more. The mHealth segment is expected to dominate the market by 2024 as more people are likely to use the health and fitness apps. Advancements in mHealth, wearable health bands, scheduling doctor appointments using mobile apps, availing reports online, consultation or video call, etc., is there in mHealth. Most promising telemedicine solutions are teleconsultancy via audio, video communications, and teleradiology. That is, transmission of X-ray, CT scans, MRI to radiologists for interpretation and so on. So, I mean, the kind of thing that I am talking about, if you are in a village and if everything has to be done remotely and the doctors are in the cities, then how do you actually do these kind of things? I'll give some examples later. Now, if you look at the scenario, a lot of big companies like Facebook, Google, Microsoft are in healthcare domain now. Amazon has launched Amazon Care, Amazon Pharmacy, Amazon DX, and for health and data science suite for availing these kind of health facilities and algorithms. So, I mean, the Government of India has a national digital health mission, which is in August, Ministry of Health and Family Welfare has established digital health mission to provide support for digital healthcare. The mission is to create digital infrastructure, health IDs, and Digi Doctors, a comprehensive repository of all the doctors practicing or teaching modern traditional systems of medicine, remote diagnosis, and so on, and health facility registry, patient health records, and electronic medical records, a digital version of patient's treatment history from a single facility. Now, you don't have the single facility. You have what is called health diaries, and the diary contains all kinds of things which are difficult to understand and so on. So there are a lot of medical startups. I'll just mention a few of them. India has more than 5,300 startups in healthcare. In 2019, 53% of angel investments were made in healthcare. In the first quarter of 2020, the healthcare witnessed 21 deals for 200. This one. My presentation is both management and technology oriented. It is not. I am not a doctor. I am a technologist. Some big deals are Meadow. Meadow is there in Gurgaon. It is there in Bangalore and so on. CureFit, Aero Health, and Healthcare Global Enterprise and so on. They're with a lot of valuations. So what are these kind of things? How do you, I was just mentioning the technologies and what it should do. What are these platform business models? Now, if you look at from an implementation viewpoint, you have a hospital, and this hospital, and all of us know that the hospital has doctors and all that, but there are a lot of other cross-industry partnerships that are needed for the hospitals, like cloud platform, other services, hardware technologies, app platforms, telecommunications, insurance, software operating systems, and so on. So how do you connect to all of them? So what we call healthcare ecosystem. In other words, you have to have hospitals and clinics, labs, pharmacies, TPS and insurance, health tech companies, doctors, modern medicine, Ayush, and other practitioners, development partners, NGOs, and so on, regulators, program managers, state governments, and so on. So they're policymakers, administrators, providers, allied provider entries, healthcare professionals, non-profit organizations. That makes the entire ecosystem possible. So if you want to analyze these things, you can make it as a platform ecosystem, which is actor networks, which consists of all the doctors, clinicals, and so on, and all that. And you have to have all kinds of resources, which are infrastructure resources, IT resources, and financial resources, insurance, and so on. You have to have institutions like the state governments, central governments, WHO, and others. And how do you deliver the healthcare to the patient finally, either through digital means or physical means, and so on. So you have to first find out who are your customers and partners to share cost and bring revenues, because you have to understand that nobody wants to work without some kind of a profit or making money. So you have to platform ecosystem has to design how to bring revenues to this. So what we call the platform is an orchestrator. What the platform does is orchestration. So you have the patient, and he calls the orchestrator. And there are a lot of soft apps like messaging and diagnosis and all that. And the orchestrator will say it is pharma, mental, physical health, hospital diagnostics, home care, telemedicine, insurance, billing, and so on. The orchestrator basically connects the patient to all these things, both digitally or physically, and connects to the platform. So every patient, platform orchestrator selects the partners, allocates the tasks and responsibilities, forms the network, and monitoring the execution. In other words, once the patient comes, depending on the kind of symptoms that the patient has, the doctor has to, the orchestrator has to connect him to the corresponding hospitals or the doctors nearby his house. And from there, he should be going to other physical, mental, physical health, and so on, and the bills and so on. So basically, for every patient, the orchestrator selects partners. So how does the orchestrator select the partners? That becomes what is called an optimization problem, and he has to allot the tasks. It will tell the doctor and responsibilities, and forms a network and monitors the execution till the patient goes back. It is the orchestrator's responsibility and so on. So there are a lot of innovations that are happening. Traditional innovation is for, we always talk of new products, new medicines, and so on. Open innovation is using successful innovations in the same or cross-industry markets or by startups. So for surgery in a village or town, one can rent the procedure kit. In other words, you need not take the kits with you and so on. There is a certain startup called Procedure Kit. And Aravind Eye Case, it provides eye case through hospital network, across the country. And similarly, in villages, you can collaborate with nurses, paramedical staff, or doctors so that the patient feels comfortable with telemedicine. Now, in the digital healthcare, one of the biggest problems is patients are used to face with the doctor and so on. So you can basically collaborate with nurses nearby in the hospital or paramedical staff, and the doctor in the city can talk to them along with the patient, and so that the patient is more comfortable with the telemedicine. Conduct annual meetings with partners and customers. So that at least they can see you once in a lifetime or once in a year, so that who are you and so on. So, and of course, there is all this data is stored on cloud. Cybersecurity is a priority. There are what are called attackers, cyber attackers like ransomware and all that will hit hospitals and health systems. Hackers conduct phishing attacks on healthcare companies and steal data and information, and also give a lot of information to the instructions to the patients to basically get them. So what India needs now with all these things that are happening is technologically upgrade healthcare services. I mean, there are some things happening, but not at the top scale, and produce healthcare practitioners, not medical practitioners. I have defined the healthcare as it is not just disease care, but you are talking about healthcare, and plan, build integrated service system, smart medical cities, smart healthcare services, smart ecosystems, and resilient digital healthcare. What is resilient digital healthcare? So when things like the fire happens or something like COVID comes in, so digital healthcare should be resilient and you should be able to take care of it. But there is a paradox. The paradox is we see algorithms, that is AI, ML, and so on. There are a lot of institutions, companies, I mentioned, they are all creating these algorithms and big data collections everywhere through cloud. But what data is needed for what decisions? In other words, if patient comes and he says he has XXX, these are all the kinds of symptoms that he has. What data you have to collect and for what decisions? And domain-specific knowledge is the solution. In other words, you should be a doctor or a yoga specialist or whatever to have the domain-specific knowledge. And this domain knowledge cannot be with one individual or one hospital. It has to be shared in the entire ecosystem. That is where a connecting platform helps. Thank you. I don't know whether you're all there or
Yeah, thank you so much, sir. We have a question for you. As part of digital health mission, are there efforts to integrate health records as centralized database? Is there also a way in which doctors can collaborate and share learnings or clinical outcome?
Yes, that is what I was saying. I mean, there are doctors, healthcare associations or doctors associations. I think they should basically more focus on how doctors can share the information and so on. So basically, this collaboration, now doctors think it is all their business and so on. But the business is now a shared business. Even if you share your knowledge, your patients with some other doctor, you make your money. The platform gives you your percentage. So that is there in this one.
So any questions here from the audience? Okay. So yeah, we do not have any more questions. So thank you so much, sir, for being with us and making your valuable time. And also, like, it was great session today. It's a small token of thanks from our end. Thank you so much for being with us.
Thank you.
Thank you, sir.
We have a small tea break now for 10 minutes. We'll break for tea and
Yeah,
we'll join for the next session.
Can you send me the tea?
Yeah, sure, sir. Virtually. So it would have been nice if you were here with us,
Yes.
but again,
I
because
know
of the situation, yeah.
I would have come now, but there is this COVID is
Yes,
helping.
it's still not leaving us, so we have
Disrupting
to
our
bear
life.
it for some more time, I guess.
Okay, nice dealing with both of you, and
Thank you, sir, for your time.
you all the best.
Thank you, Professor. Thank you so much. Have a good day.
As an old man, I can give you only blessings. Thank you.
That is really precious, sir. Thank you so much.
Thank you, sir. Have a good day.